to just give you a little bit of information about some projects that we're working on together, and something that most people wouldn't think that the city of Wichita is involved in, but it's a huge issue. Almost every day I get asked, what's the biggest issues facing Wichita? And I usually say, well, it depends on the day. But I did not expect childcare to rise to the top, and especially for me to become such an advocate for it. So we're just going to tell you a little bit about the story, and then we are going to be hopefully have some time for questions. I always say my favorite faith leader within the city of Wichita says, "Blessed are the brief, for they shall be invited back." So if I do this right, I'm brief. I let the expert talk, and then we let you ask questions. So Tanya and I are both proud members of the Wichita Coalition for Child Abuse Prevention. You can see the mission there. And we just thought we'd let you know a little bit about how we got here, like build up the foundation for this. So I got asked to join the coalition. I started my career as a school counselor. I was an adolescent substance abuse counselor. And so children have always been at the heart. And I really believe that we should not just focus on trying to make kids better. We should make the world better for kids, right? So that's always been the work that I've done. And so I got asked to join the coalition. It's during COVID time, and my first meeting is Zoom. And you know, it's the little Hollywood square boxes, and everybody's talking really fast, and there's a million acronyms. And I just humbled myself, and I reached out, and I said, can we go to lunch? And would you please just catch me up on everything that was going on? We did. We became fast friends, and now I call Tanya the Force. So please, you'll understand why in a few minutes. But during the call, the Zoom meeting that I was on, they said something that was surprising to me. They said that there was an ordinance within the city of Wichita for child care that was more restrictive than the state of Kansas. And the state of Kansas is already considered to be the third most restrictive in terms of child care regulation. And I'm all for keeping kids safe. It needs to be paramount, of course. So I went back to our office, and I got with legal, and I got with some other folks, and I said, why do we have this ordinance that's more restrictive than the state for child care regulation? And the city of Wichita does child care licensing, and we have about 13,000 kiddos underneath our umbrella that we try and keep safe every day. And no one can tell me why. So we ended up digging out the ordinance, and lo and behold, it hadn't been reviewed since 2007. And still no one could explain. So we pulled together a group, we got the state involved, we got our folks involved, we got Child Start and other experts involved, and I'm proud to say that last year we changed the ordinance. So now that we're in line with the state, and I'll have more detail in a moment, but that's kind of the catalyst for all the other great work that we're gonna tell you about. So the city's been very, very involved. So lo and behold, then the state hears what we're doing, and they hear that we're very involved in this, and that we're trying to get our regulations up to the state standards. So Senator Blasey, Chase Blasey, is a fantastic representative, does an amazing job at the state level. He represents the western side of our great community, and he got involved. And then he introduced some regulation at the state. And so all of a sudden, we're going from nobody's really talking about childcare unless you have kids in childcare, to now we have people in the city talking about childcare. We have employers talking about childcare, and we have our legislators talking about childcare. So within just 2 years, we've seen a great amount of momentum. The other thing that we created is we realized that, you know, sometimes I think we're all responsible for doing this. We think we know what everybody else needs, but we don't ask them what they need. You know, we're gonna prescribe the solution for you without even talking to you. And we kept hearing that workforce, that employers were having trouble with childcare. Was, you know, we all know there's a workforce issue in the city of Wichita. And everybody kept saying, yeah, it's such an issue, but we weren't talking to the workforce. We weren't talking to employers to see what they actually needed. So the last thing the world needs is another coalition, I understand. But we did feel that a work group might be a cool name for it. And we created a group of employers. And this is what's really, I think, great, and probably not surprising now, but it was at the time when we started it. We have Spirit, we have Textron, we have Cox Machine, we have small employers as well. But we have heard unilaterally across the city that if you have employees, you have childcare issues. It's an issue for you. And that employees aren't coming back because they can't find childcare within the city of Wichita. So it's important, and the reason that it's important, even if you don't have children in childcare or children, you know, involved in the system, if you have employees, they do. If you have people that you go to church with, your friends, your family, your neighbor, it impacts people in so many different ways. But it also impacts us as an environment and as a community. The #1 predictor of adult health is 3rd grade literacy. The #1 predictor of adult incarceration is 3rd grade literacy. So the more prepared that we can get our kiddos to go to pre-K and K not only are their lives impacted, but our community, our state, our country is impacted. And so it really is an issue that we should all be concerned about. And then according to the latest Child Care Aware of Kansas data, we only have about 41% capacity for child care. And we need more facilities. I think we all know that. We have home facilities where people can take their children, or we have, center-based facilities. But the biggest issue is the workforce. If we build a new shiny building, that's great, but you're just gonna take the providers from the other centers or the other homes. So that's one of the things that we're also working on, and we're gonna tell you in a moment, is how do we get more people to want to go into childcare? Okay, please do. The floors.
Sorry, data is my thing when it comes to this world. So when we're saying 41% of the demand, what it is the statistics are for 2 adults working in a home with children under the age of 6, and that's where we get this data. So it's kind of scary, but here's the truth, and I'll get on my soapbox in a second. But before COVID, we were at only 45% of the demand. Childcare has been a crisis since before COVID. Fortunately and unfortunately, so I have to take a step back and be thankful, it wasn't a true issue in our community or our state until it became a workforce and economic issue. It was always an issue, so I'm just really happy that now it's an issue that's getting elevated, and we couldn't have done it without. We couldn't have. She truly got us elevated. I can preach all day about what I love and why it's important, but unless I have other folks backing me up, we wouldn't have gotten this far. So we're happy to be here today and have you hearing us out.
I say all the time, she's the expert, I'm the advocate. So it's a great team. It's a great team. And then the average cost of childcare is over $1,000 each month for full-time childcare. Huge. That's a lot more than people pay for their mortgage. And so we always talk about we need safe, reliable, and affordable childcare. One more slide for me, and then I'm going to turn it over to the expert. But as I mentioned, we were able to change a city ordinance. We were able to get in line with the state in terms of the number of kiddos to providers, change the ratio, something that was very exciting. It added about 600 more child care spots within just the city of Wichita. So we felt that that was a huge win. The other thing is then I started hearing from other electeds from across the state, and especially within our region, saying you did what, and how did you do that, and how can we get involved? So just having it was in the paper, we got lots of media coverage about it, so it's raising again the awareness and bringing some attention to things that still could be done. And we still need many more spots, as we mentioned. We just made one small step, but we're gonna make more steps in the future. I'm gonna pass it over to the expert.
Thank you. Hello, again, thank you for having me. And I'm gonna give you a little bit of backstory on Child Start and then kind of my personal reasons for why I'm so attached to this organization. So Child Start was created in 1958, and it was United Way funded, just a teeny little thing that was representing providers who just needed that nursery childcare and a little bit of training. Today we have licensed childcare providers. So in 1958, we didn't have licensed childcare providers who were being regulated and monitored by the state, hence some of the things that we're working on. But we do need them because we do have a lot of deaths and child abuse rates that go up when we have unregulated childcare that's happening. So fast forward to 1976, we have our Head Start that we were able to partner with. So with Head Start, it's a program that serves 3 to 5-year-olds, and every single thing we do for these families, because they are low income, children with special needs, everything we do for them is free. So we offer full day programs where they get education. We partner with dental clinics so they can get their screenings and cleanings. We partner with vision and hearing and rainbows. We have a lot of partners to get this work done, and every single bit of it is absolutely free for these families. Fast forward to 1990, and that's where your newest Rotarian, Mandy, she actually oversees this program. And it was established in 1990, and it's a statewide network, and these are the folks who take care of and support those licensed child care providers. So they go out, they coach them, they mentor them, they offer them support. If their families are struggling, they offer the family support. All of this 100% free. Times have changed. There used to be 15 of us kind of working through the state. Now there are 5. So her team is very spread out, trying to get the work done to support these providers. Very important work. And then 1995, we added our early Head Start. So those are our 0 to 3 children. These are the even more vulnerable ones that, even just left alone for an hour, things can happen with them. So it's really important for them to be in a quality program. But we also have pregnant women. So we actually go into homes and we set up pregnant moms' environments so it's safe and ready for a child to be born into. We help support them with, do you know what's going to happen? Are you going to breastfeed? Can we get your sonograms? We pay for all of that for these parents so that we can get them ready for success. So for me personally, 20 plus years, it's more than that, that's an old profile, but when I was 16 years old, I was struggling in school. I had actually been kicked out of my 4th high school. And I made it to my 4th high school and I was in a science class. I am not a science major. He did not change my life in this way, but he did change my life. A science teacher looked at me and he said, I don't think you're this kid. I think you need some support and I think you don't have that and you haven't received that. So he said, there's a program where you can leave 3 days a week and go play with kids. I was like, yes. I was already in a situation where I missed a lot of school, so why not? So these were Head Start children. These are very vulnerable children, in vulnerable situations, and it's probably what I needed when I was their age. I did that all the way through until I graduated, and then I got a child development associate degree, then I went to early childhood, and then I just kept going up through my master's, and I've never not been in this field. So when I say it's so important, and the earlier they can get help and support, look at me now, it worked out, but I know that these children that we're working with, these providers and these families, they need us, and they need advocates, and they need just people to be there for them. It's a lot for me, and I can get really passionate about this. So. Okay, I'm gonna let Becky do this one, then I'll take back over.
All right, thanks for sharing your story too, very cool. I do want to pause for just 1 second. It was interesting, something that Tanya said really resonated with me that, I mentioned depending on the day is, what I think is the most important thing for the city. After this meeting I'm leaving and I'm going for a meeting where I'm trying to secure funding so that our firefighters can have additional cancer screenings. So every day that I have is different. And so sometimes people think that childcare is kind of a soft issue. And I was speaking at Leadership Wichita. Who's been through Leadership Wichita? Yay, 2015, best class ever. No. So if you've been in Leadership Wichita, you get it. So I was speaking, and somebody said top issue, and I mentioned childcare, and a woman said to me, I'm so glad that you're championing a woman's issue. And my head spun around 3 times. And I said, this is not a woman's issue. This is a community issue. This is a workforce issue. But most importantly, it's an economic development issue. And you'll learn a little bit more about that when we talk about the Greater Wichita Partnership and how they've jumped into this work too. But just something that's so important to so many. And one of the things that happened is the National League of Cities is a professional organization for elected officials. And so we are members as the city of Wichita. And so every year we travel to DC for the conference, and then we go and meet with our electeds at the federal level and lobby for our legislative agenda. And then they have a mid-year conference, but they have lots of other activities and support tools for electeds so that we can network with each other and, find out what's going on and who's doing great things in homelessness or, economic development or whatever the topic may be. So as members of the National League of Cities, I got an email. And they said, we have been hearing about Wichita, and I don't know how, but the great work that you're doing in childcare. And we are going to be starting what they call workforce entrepreneurship, and we are selecting 7 cities who we feel are really championing childcare and having electeds involved in some capacity, and we would like the city of Wichita to be one of the cities. So yay, we were selected. I know, let's clap. We are one of 7 cities that now is working together. So for me, and Tanya's going to go into a little more depth, but the best part is we're getting to learn and steal from other communities. It used to be R&D was research and development, and now R&D is rip off and duplicate. And that's what we're doing. We're ripping off and duplicating what some other cities are doing that we feel are great, and hopefully they'll want to do some of what we're doing as well. We also get a very small stipend. It's $15,000, which isn't a lot, but it will help perpetuate some of our initiatives. So I don't think we always tell a good enough job as the city of Wichita being, the community, but then also the city of Wichita being the municipality, the big C. Some of the cool things that we're doing to help our community. Y'all know when you turn on your faucet what we do. Y'all know when you drive in our streets what we do. Y'all know when you go to our parks, et cetera, et cetera. But not many people realize that Wichita, the city of Wichita, has a space in childcare that's very important. I'm going to turn it over to Tanya. She's going to tell you about the project.
And I have to add too, just as a win for Wichita and how amazing it is. So I'm a military spouse. My husband's active duty Air Force. We PCS'd here 10 years ago, and he got orders to move to Missouri about 8 months ago. And I said, I love you, but I'm a Wichitan now. And he is gone for 2 years. We visit on the weekends. We're great. Everything's good. But this is now my city. And I believe everything I've been doing and the work and just, it's an amazing community. So I just couldn't leave it. It didn't make sense to leave. So I officially changed my license a few months ago. I kept my other license the entire time. So I really am now a Kansan. So when this came up, Bob Layton called out of nowhere and said, hey, we have this opportunity. Do you think it's worth it? And I said, who cares if it's worth it? This is going to elevate the conversation. It is only $15,000, but it's $15,000 that we're going to take and we're going to make sustainable for early care and education. So what we did, and Becky can attest to this, we're supposed to come up with one goal. We have one goal to spend $15,000, but we're Wichita. So we gave them 4. And they said, well, that's great, but we only need 1. I said, great, but you're still going to hear about all the 4 that we're doing. So what we realized, and now the ordinance changed, the one earlier basically was they were only allowing 10 children for 1 adult versus 2 adults and 12 children. The ratios are smaller, it just makes sense, and it increases slots. The one we have now that seems to be an issue is providers have to live and dwell in the home that they run their business out of. They can't have another property that they go in, just like anybody else who has a business or goes to work, turns the lights on, works for the day, and then leaves. So we have a lot of people who get burnt out because they have to live and stay in the home all day and work there and just kind of want to check out at the end of the day. So that's a simple ordinance change that we're going to work on. Really easy, doesn't cost $15,000, so why not throw it in? I'm going to skip past the business development because it's tied to our summit, and then Becky may add a little bit to what the Greater Wichita Partnership's helping us with, but we're trying to create a family-friendly city. We want Wichita to be on the map for being designated as a family-friendly early learning city that people want to come and move into. So that's going to tie into our economic development and hopefully growth. And then something that's really big that, it's going to take some time to push, but Oklahoma did achieve this last year, and they're able to get free to low cost health care benefits for our licensed child care providers. When I say licensed, I'm meaning our family child care providers. So these are people who have a business that they run out of their home versus a big center like La Petite or, the bigger ones you see. So they don't have health care benefits. They're self-employed, they have their own small business, but they don't get treated as such like somebody else who has a business. So we're trying to elevate them as well as the community to recognize that these are small business owners and that they do deserve the same benefits that other folks do. So what we're doing is we're taking our $15,000 and we are creating a summit. In that summit, it's going to be a half day where we're gonna elevate these family child care providers. We're going to tell them they are important, the work they do is important, and they deserve to be treated as small business owners and professionals. So we're gonna have a few sessions and keynote, and then what we're gonna do when the keynote comes in, we have an attorney who specializes and is aware of a child care tax credit that we're really trying to push across the state. Only 5 minutes. Only 100,000 of the $3 million was utilized in the tax credit last year, so we're really trying to push businesses to partner up. And then the day of the summit, businesses and employers will come in, and we're gonna have them work together and achieve some of these outcomes. We want them to work with providers to understand what they do, and maybe we can have them partner together. We don't have all the money in the state of Kansas to keep giving away and asking for more money, so what we need to do is get the people to come together and work together. So if you're a business and you want to offer childcare slots so that you can increase your employment, we partner with a provider to say, hey, I like you, I like your mission, works with my mission, let's work together and let's increase slots together. So we want to foster those connections and have business leaders, and we're looking at having a lot of our legislative members there too, and also holding a third kind of round table with them. And then it's just heightening, my biggest thing is heightening awareness. I'm not gonna come here today and ask you for money. I'm just gonna come here today and say, can you please tell people that this is important, that early care and education is important, and it can be life-changing. And if you want to attend this conference, as you know, we would love to have you, but this is something that we just raising the awareness on the importance and what it leads to in the economy and what it can mean for Wichita.
I'm going to just make a couple comments and then a couple of minutes for questions, but when Tanya mentioned, I would elaborate just a little bit more on the Greater Wichita Partnership. The Greater Wichita Partnership, REAP, which is the Regional Economic Area, I can't remember the P is, sorry, right now, program, I think. The City of Wichita, Sedgwick County, and the Wichita Regional Chamber of Commerce have a legislative agenda, a joint legislative agenda for the state. And child care is one of the issues on there. And it's because REAP will tell you, the Chamber will tell you, Greater Wichita Partnership will tell you, our economic development team will tell you, when we are recruiting new industries, new businesses, new employers to come to our great city, they always ask about land, they ask about our utilities, they ask about our taxes, and now they're asking about child care. Are we friendly? Do we have a good child care system? Which is a shift that we haven't seen before. So that's why we're making sure that we're bringing the business component. The other thing is when I talk to home child care providers, we used to call them babysitters, right? They're not. They're small business owners and they're entrepreneurs, and I tell them, you are not in the babysitting business, you are in the brain development business, and you need to make sure that you are respected, and that's the great reason for the summit, so that we can give them some tools and some information they need so they can be successful entrepreneurs. That's what we want them to be.